everyone. I will be speaking on the topic of evaluation of the objective factors affecting the visual outcome of ONSF in patients with IH. It was a study in COVID era. IH is a clinical syndrome of unknown etiology in which intracranial pressure is raised in the absence of vascular space occupying lesion. It's a disease linked with obesity. Its importance lies in the fact that it can lead to irreversible vision loss. The mainstays of the treatment include weight loss and medical management, and those who are refractory to medical treatment, surgical intervention is required. Options include ONSF surgery or CSF diversion procedures. So why we did the study? Improvement of the stabilization in the visual outcome in the terms of both visual acuity and the visual field after ONSF for those who diagnosed with IH is documented by various studies. Few studies evaluated the demographic and patient subjective factors to predict the outcome after ONSF. The paucity of the literature still on this is objective factors like RNFL thickness, optic nerve sheath diameter to predict the outcome. So our primary objective was to evaluate the objective factors, both the functional and structural parameters affecting the visual outcome over the period of 3 months, if possible up to 6 months in patient diagnosed with the IH planning to undergo ONSF. It was an ambispective observational single center study. Sample size was 12 patients. Time period was 3 years. Place of study, Department of Ophthalmology, AIIMS, New Delhi. So after satisfying the modified Dandy criteria, the patients with the IH came to the neuro-ophthalmology department. Those who need the surgical management after meeting inclusion criteria were underwent a comprehensive history taking like associative factors of IH, age at onset of IH, time to ONSF, and general examination like BMI, weight, ophthalmic examination BCVA, anterior segment examination, clinical picture of the fundus to document the stage of papilledema, and other investigations, opening pressure of CSF that already done in the Department of Neurology, OCT to evaluate RNFL and GCL IPL thickness, VER, USG for optic nerve sheath diameter. And after the comprehensive examination, patient posted for the surgery, all investigations were repeated on post-op day 1, 2, 6, 12 and 24 weeks if possible. So study recruited 12 eyes underwent ONSF surgery, and out of 12 eyes, 7 I evaluated the prospectively and remaining 5 eyes retrospectively onto COVID-19 pandemic. Mean age of the study group was 34.5, mean weight of the population was 66.5, mean BMI was 25.76, mean time to ONSF was 108 days. So coming to our major objective changes in the functional and structural parameters over the 6 months in either eyes. This is a best corrected visual acuity graph in which we can see there is an improvement in the either eyes in the post-op follow-up period, especially at 12 and 24 weeks in the operated eye and 24 weeks in the fellow eye with a statistical significant value. Coming to the amplitude of visually evoked response, there was an improvement in the either eyes with the p is equal to 0.04 that is statistically significant at 24 weeks in the operated eye. Now to this latency of P100, there was a significant reduction in the post-op follow-up period with p is equal to 0.02 and 0.046 at 6 and 12 weeks in the operated eye, and there was a significant changes in the 24 weeks in the fellow eye also. Now getting into this is OCT changes, RNFL thickness got decreased with a significant value of p is equal to 0.04 for both the operated eye at 6 and 12 weeks and at 24 weeks in the fellow eye. Coming to the GCL IPL thickness, it got stabilized over the post-op period even though no significant change was noticed. Now to this is optic nerve sheath diameter. On this is axial section. We can see that there is a significant decrease in the immediate post-operative period, especially in the operated eye with the p is equal to 0.02. We also done a correlation with this is pre-operative functional and structural parameters with the final visual acuity. There was a strong correlation found with the pre-operative visual acuity with the final visual acuity in either eye with this statistically significant value of p is equal to 0.04. There were also strong correlation found with the time of this is ONSF with the final visual acuity in both eye with R is equal to plus 0.83 in the operated eye with and R is equal to plus 0.81 in the fellow eye. Pre-op ONST also showed strong correlation with the final visual acuity. So coming to the conclusion, ONSF surgery helps in either improvement of the stabilization of the visual acuity in either eyes, improvement in the objective parameters indisputably obvious the need of bilateral ONSF in all cases, improvement in the final BCVA primarily depends upon pre-operative BCVA, time to ONSF and pre-operative ONST on axial section. My limitation of the study was the sample size of the study was small, didn't represent the general population. This was an ambispective study. Structural parameters couldn't able to assess in all patients. Thank you so much.
Any questions?
Hello. In which route we access the optic nerve?
Sorry, sir?
Which route you access the optic nerve?
Sir, we
Is it endoscopic or open route?
No, sir, in the open route only, transconjunctival approach we have done.
You never tried, endoscopic route?
No.
So which part of the optic nerve is mostly you access?
On the medial aspects, sir.
Only medial aspect. But you go enter into the orbit through medial route
Yes,
or the
sir.
lateral route?
No, sir, medial route. We have isolated the medial rectus muscle, and the part of this stump is actually, we've kept it over there, that after cutting the tendon, and we passed ethibond, 50 ethibond through that remaining stump, and then we retracted the globe and reached this retrobulbar space.
Yeah, what are the preoperative vision of this patient?
Sorry,
All
sir?
the patient preoperative vision,
Sorry?
preoperative visual status,
Ah,
all the patient.
most of the patients were PL positive, hand movement close to face, visual acuity, and we couldn't able to assess the visual field or color vision or contrast vision in our cases, sir.
Do you do VEP of that all the patients
Yes.
before surgery? And after surgery, what is the outcome?
The outcome after, especially after this is immediate post-operative period, what we found is actually optic nerve sheath diameter got decreased, but VR actually changes is coming nearly nearly around 6 months only, sir. And
Do you do any MRI in the brain to see the ventricle status?
sorry, sir. Sorry, sir.
MRI
brain.
of the brain
Yes, sir.
to see the ventricular status, the dilatation or anything else?
Yes, sir. We prior to the surgery, we see this is dilation of this. We should see this, how much the nerve sheath is distended, and then only we will plan to operate the patient.
In the topic, why you added the word that this is study in COVID era? Is it making any difference?
No, sir, not because the sample size was too less, and none of the studies is not conducted recently so far, especially in this is ONSF. So just to highlight that only, not that much.
Any role of intraoperative and postoperative steroids you have not mentioned, or it is not a part of study?
No, sir. There is no role of this steroids.
Intraoperative.
No, sir. No role of the steroids in our center.
Ma'am almost does the same thing, like you need to compare your findings with the existing literature because that is part of your presentation.
Yes.
So I couldn't see the discussion part as such. You straight forward, like after results you went to the conclusion. So basically you have to do some comparison of what is the strength of your study or what is different from
Okay,
the
sir.
existing
Okay.
literature should be highlighted.
Okay, sir. Objective factors evaluation we are doing the first time, and this is entire world. Maybe that might